Hello and welcome to our AMHC community chat with Rebecca Fournier of Aristic Mental Health Center. Hello, Rebecca. How are you today?
Good. How are you?
Great. I would love it if you could just share a little bit about what you do with AMHC.
I am a substance abuse counselor, and I've been working with AMHC for about 15 years. I worked as a substance use disorder counselor for the first little while at the residential treatment facility with the Aristic Mental Health Center, and that's a 28-day treatment facility. It's a co-ed facility, so treating both male and female clients. And so I worked here for the first part of my career and then switched over to outpatient in Caribou for a while and returned to be their site coordinator manager at the residential treatment facility last year.
Awesome. So it sounds like you're pretty busy over there at the residential treatment facility. And I'm glad that this is a service that's available to the people of Aroostook County. Is it generally people from the county who are there for treatment, or do you get people from outside of Aroostook?
We serviced the entire state of Maine. Prior to COVID, we were a 12-bed facility, but due to COVID, we have had to reduce our beds to 8 so that everyone can have a single bedroom. And still serving the majority of Maine, however, paying special attention in ensuring the safety of our clients and accepting clients from counties with lower level COVID rates, but still definitely keeping every referral that's coming in and monitoring that on a weekly basis so that if there's ever a shift in what's happening in their COVID situation, we can get those people in as soon as possible. We still are treating male and female residents, and we have primarily at this point in time a lot of people coming from Aroostook County.
Awesome. So when we talk about these folks who are dealing with substance use disorder and addiction, what kind of stigmas do they generally face?
Actually, I just had this conversation this morning with some of the residents that were here during one of our morning group sessions. And if you don't mind me sharing just some of their feedback, the stigma that they face is just a feeling that they are a lower level citizen than the rest of society. And because of that, not having the empathy from the people that are in their community and also their healthcare professionals and the law force. They feel like sometimes they are, it's not seen as a disorder or disease, and there's a moral stigma attached to it rather than health concern. And so because of this, they are pushed aside, or rather in their words, incarcerated. And that while they're incarcerated, there just isn't the support that they need in order to get better there. I think things are shifting. We definitely have seen our local and other county jails supporting clients who are struggling with opiate addiction so that they're now able to have their induction of Suboxone while incarcerated. And that's a positive thing for those who are coming in dealing with withdrawal symptoms, but also upon discharge from their incarceration, that's when we see an increase in overdose rates. So if they are on Suboxone when they leave, there's a less chance for them to overdose.
And that's interesting that you brought up the overdose statistics. We've definitely seen a number of drug overdose related deaths here in Aroostook since the pandemic began. Why do people have a hard time asking for help or accessing? Is it feeling like they can't access, or they don't want to access, or is it just they have a hard time asking?
I think you're onto something. That's a combination of all those things that you mentioned. I think in the last little while, the increase of overdose, we say here that the opposite of addiction is connection. And one of the things that has happened in our society in the last 6 months is that we have had to self-isolate or social distance. And that's a barrier for those individuals that are trying to make the connections needed in order to thrive in their recovery. And so the local AA and NA meetings for a period of time needed to close their doors, and they were very quick to link people to Zoom meetings. But there was a transitional period of time where people have to gain comfortability using that technology. And it's still not the same, as you and I both know. Having a personal conversation directly sitting in the same room with somebody is a much more intimate connection than you have when you're meeting over a Zoom. So I think that that's one of the barriers, is that the opposite of addiction is connection, and the opportunities for those connections have been reduced since COVID has started. I also think that people do struggle to help ask for addiction, and part of it is due to the stigma surrounding it. The stigma that they've received from society, they also hold in their own hearts. They also feel like perhaps they're a lower level citizen than the rest of the people that are around them. And so asking for help means that I have to go and talk to somebody that maybe I feel is better than I am, and they're dealing with their self-esteem issues. We were just talking again this morning about even going to AA, NA, outpatient meetings, that sometimes in order to go to treat their social anxiety or their just those feelings of unworthiness that they've had to use in order to even gain the confidence to go. So definitely some of the things that have led them to use are barriers for asking for help.
Wow, what a vicious cycle. And, you know, it's important when they're going through that addiction treatment that they look at ways to break those cycles and find new ways of facing the things that can be an impediment or a barrier, for sure. So do most people typically benefit from a residential addiction treatment program? Is it something like, oh, everybody who comes in here leaves clean and stays that way forever? Or is it, do you have people that it's just not the type of treatment that works for them?
I guess to answer that question, that when we have a client that comes into treatment here, it's because they have met the ASAM criteria that we use to determine what level of care that client needs to be in. And it's something that we assess on a weekly basis here, is this the right level of care for them? Their outpatient counselors or their referral sources have done the same thing. What is the best level of care for the individual that I'm treating? Where can they best get their needs met? So I don't know that residential is the answer for every single person, but for individuals that have tried and exhausted efforts in outpatient or on their own or in detox or whatever level of treatment that they had used prior to, it definitely is. This is probably one of the highest levels of care that they receive, is an inpatient residential care. Now, the people that come here, they come here with a variety of motives. Some of them are to get clean. They really want and desire to have a change in their life. And I guess everyone that comes here wants change in their life, but the change could be different from everyone. For example, if somebody's really struggling with legal issues, they may find that coming to a residential treatment facility would benefit their cause. And I just had this conversation again with the group today about how in that situation, people would say, well, that individual is not really interested in treatment. They just want to look better for the courts. And I think that that's a stigma as well. I think that everyone, like I said, that comes into treatment is frustrated with the way that their life is going. And this gives us an opportunity to sit and chat with them and really give them a stable living environment, to show them a new way of living. And I think that for some people that come in with a motivation that I'm going to resolve some of my legal issues, have left here thinking completely different. I need to not just resolve my legal issues, I need to resolve the way I've been thinking and living. So I wouldn't say that 100% of the people that leave here are really able to maintain sobriety, but I think that our success rate is according to our clinical outcome surveys that we were sent out was over 50%. We do have individuals that return to our facility, and our doors are always open to those individuals that if they've left here, maybe they've weren't able to maintain long-term sobriety and they relapsed. We ask, we tell them when they leave, we're not going anywhere. You're welcome to come back at a later time. We do a lot of discharge planning with them. That's from the moment that they walk through the door, we're really focused on making sure that when they leave here, that they have the supports in place that will continue with them in their recovery journey. I'm really happy that we have locally an opportunity to connect people with recovery coaches. That's been a huge asset to the process of people leaving here. We make sure that they bridge the gap between leaving here and getting into an AA or NA meeting. So connecting them with local groups and members through help hotlines. If they need to have, if they're looking for employment, we're connecting with them with ACAP to make sure that they have the services there that are in place for returning to work and maybe possibly going to school. We have connected them with sober living, and especially locally, again, our sober living house. Within the first little while, it was full, and we had individuals here in treatment that were still looking for sober living when they left here. And there might be one bed, but there was 2 or 3 people here that were hoping to get into that one bed. So definitely a need for sober living. We connect them with primary care physicians, especially if they've not taken care of their physical health for a while, they've neglected it, making sure that that's a connection that they have when they leave here. If they are in need of housing, using the BRAP services, that starting that process with them. So there's a lot of discharge planning that happens with the clients that are here, because we know that 28 days is not enough. This is a beginning. This is a reprieve for them, a chance for them to take a breath, refocus, and say, what direction is my life going? And then for us to help guide them in that direction.
And I love that, you know, even if it's not a 100% success rate, that you're planting those seeds right from the moment they walk in the door that they may access later on. You know, even if this particular go around in treatment isn't effective for them, they're going to be leaving at least with a handful of tools that they could call on if they make that
Sure.
choice again. That's awesome. And I'm assuming that a lot of your programming revolves around relapse prevention, seeing that you're kind of a shorter term, 28 days as far as residential treatment goes. And so there's a lot more of that has to happen pretty quickly, I would say.
Yeah, absolutely. So the clients, when they're here, it's not a spa. It is definitely treatment. There's no TV, there's no radio, there's no electronics. They enter into a world of just learning the whole entire time that they're here. So they're in group for 7 hours a day, every single day. And when they're not in group, we give them books to read and videos to watch. And what we would like for them to do, and what their treatment plan is that they read that material or they watch those videos, they do book reports or video reports on them, and then they present that to the whole entire group. So a couple things happen there. They are able to, by reading it, writing, and sharing, retain some of that information. And also, when a client comes here, there's no way that they're ever going to read all the material that we have here. So by listening to other people share their book reports, gives them exposure to all of the different books and material that we have. They also are required to maintain a daily journal while they're here. And then they bring that journal in and they read it out loud to the staff. And our hope is that we can develop this as a therapeutic tool when they leave here, that if they're alone at their home and they're really feeling overwhelmed, maybe with some of their emotions or some of the things that are happening in their life, they can turn to that journal, they can write it down, they can let some of that stuff go, bring it to their next therapy session or outpatient counseling session, and process it with that outpatient counselor. And I know, after talking to people that have left here, that many people continued to journal when they left the RTF and found it very helpful. For me, the 7 hours of groups, they do focus on understanding your addiction. Number one key, understanding the disorder of substance use, what it does to your brain, what it does to your body, why it is that you find yourself continuously going back into using, that this is a scientific thing, that this isn't a moral failing on your part. And then the other part of our treatment is recovery enhancement. So people come to us with different levels of understanding of recovery. Some people have, this is their first attempt. Other people have been trying to get clean for years. So taking what they have, building off of it, introducing them to different techniques or roads to recovery. And then we also focus on relapse prevention. So some of that could be some underlying issues, maybe some guilt, shame. Maybe they grew up in an alcoholic or in a house where drugs were used, and they are now adult children of alcoholics. And so dealing with some of those issues, maybe there's some codependency that they're dealing with, grief and loss. A lot of people that come to us are suffering from post-traumatic stress disorder. So looking at some of these underlying issues that continuously lead them to relapse, and not healing that, but understanding that that is one of the components that lead you back to relapse, and giving you some tools and how can you manage that.
Yeah, and I know that that's so critical, is looking for the root cause of why people turn to substances or alcohol to kind of deal with whatever it is that they're going through. So finding out what it is can only help the healing. And it may not happen within your 28-day window, but it's certainly planting those seeds for future healing and continued recovery as they go forward.
Many people that come here are have very eye-opening moments while they're here. I think not having the distraction of the electronic world allows them to go into the groups, leave, process the information, and the people that come here are super blessed because they are in one of the most beautiful places in the world. And I say that honestly right now as I look around, and all the trees are just amazing. It's like we're in a mystical flower garden of trees here. And we have this giant field that's behind our house, and people walk over the knoll and they find some serenity and peace while they're there.
That's awesome. And I love that this place is right here in beautiful Aroostook County and just around the corner for anyone who needs it. And it's so sad when we hear these stories of people suffering alone, or, you know, holding these secrets in and not getting the help that they need or want. And so to know that it's right here, it's available, and people are here for you, can be very, very encouraging. So how can people access the residential treatment facility through AMHC? Like, how long does that, what does that process look like? How long does it take? Do they apply? Is there a chance that they wouldn't get accepted? How does that work?
So we get a lot of phone calls from individuals that want to do self-referrals. We do ask that the referral process be done by somebody to support them along in that journey, such as a professional, ideally a substance abuse counselor, but a social worker. So we definitely get lots of referrals from the hospital, from the social worker that's on staff there. We do have some DHHS referrals, whether that's due to some issues with the family dynamics or directly from their incarcerating, coming to us from that way. So all of these referral sources would contact us, our program, and we send them a referral packet. Now, we've been really working to streamline this process and reduce as many barriers to access to our service as we can. So we've shortened that referral packet, and they send that out to us. And it gives us a little picture of what the individual is dealing with. And we want to make sure that we're matching them with, again, the best service possible. And so we review that information, then we would call them with a bed day, a day that they could come into our treatment facility. And then after they arrive for treatment here, within the first 72 hours, everyone has to have a physical completed. So, Stacy and Mike are intake coordinators, and they work super hard to make sure that there's no gaps, that our beds are full. And the reality is there should be no reason our beds shouldn't be full, because our waiting list, there's always a waiting list. And so just making sure that we are, as soon as somebody leaves, there's the other person's coming in that same day.
Awesome. And that's really good, because I know a lot of people, when they make the decision to get treatment for addiction, that it can be something that if they have to wait too long, it could be too late. And so it's really important that people can access the help and the care that they need at the moment that they need it. And so I love that at the very least, they're touching base with people who are already beginning to help navigate them through to get to you, and
Right.
working with them to make sure that while they wait, they kind of have some support.
Yeah.
That's great.
In our wait list, it varies. Like we've had miracle beds show up right at Christmas time. We had a story where a patient was over at Care Medical Center, and it was Christmas Eve, and they really needed inpatient treatment. And due to a variety of like circumstances and events, we were able to get that individual in the same day. And I think that is a miracle bed. And the story is so much richer than that, but I can't share it. And it just was really, like, honestly, I felt like it was a Christmas miracle. And that person is doing well still today.
That's awesome. And I mean, as someone who's doing this work, those stories have got to be so powerful for your passion and for your desire to help people, to have those stories kind of fuel your motivation to keep going and doing this work.
We one of the things that we are doing out here is we have a garden project, and that garden project is more than just about feeding the clients that are here. It's about teaching them a practical skill, and also kind of grounding them. So a way to like just find a relaxation tool. Maybe it's another hobby that they can do once they leave here, and also connecting the symbol of growing a garden with growing yourself. And you've already done some of that by saying, we've planted some seeds. And I think that that's exactly what we try to make those connections with too, that there are seeds that are being planted here, and that in order to nourish those, you are going to need certain things in your life to continue to nourish them so that they'll continue to grow, and making sure that those fertilizers, those things that are needed, whether that is meetings or recovery coaching, or all the things that we connect them for discharge planning, are there, and they're in place in their life to continue to nourish the recovery. And then at the end of our the clients come in, it's springtime and they're planting. Those clients have long gone by the time it's harvest. And for me, that's symbolic too, because there's a lot of times that I've planted the seeds and I have no idea what the fruit of those outcomes were. I do have to share a little story that we had. We're trying to expand on our garden project, and Gabe Brown he's a staff member here. He's been collaborating with us and with the clients and making sure that continues to grow. And so we had an opportunity. SW Collins gave us some discounted material so that we could expand and make some more garden boxes. But we needed a carpenter to come and support us with this. So I reached out to the recovery center, the Roads to Recovery, and there's a few carpenters that hang out there. And so a former client just recently came over and helped build the garden boxes, and shared while he was here that he had 180 some days clean, and he looked wonderful. He was doing well. His family and him had just bought a new home. So like, I cannot share enough about how powerful those stories are. Those are the motivators for us, that, this is the right job. This is what we should be doing. Because for me, this isn't just, it's not a career, it's a passion.
And I love when we see Aroostook County people coming together to support other agencies and the great work that people are doing, even just the donations of the supplies to expand your garden project, and bringing in, alumni of your place, to come and serve. And it's a powerful testimony to the communities that are seeing this happen, and to the people who are there seeing these people that are in successful recovery coming back to give back. And that's awesome.
For sure.
That's really awesome. Well, do you have anything else you'd like to add?
I think that the only thing that I really want to add is that we talked a little bit about the stigma before, and I just really want to make sure that that's out there, that substance use disorder is just that. It's a disorder for somebody that's using substance. And if we had an individual that had an eating disorder, we wouldn't say that they were food abusers. We would, we would say that they have an eating disorder. And I think that when we change our language, we begin to change the way we think about it. And these people are desperate for help, desperate for help. And they need us to think differently about how we are approaching our treatment with them. And if somebody is coming in to the emergency room with an overdose, it's not 30 minutes later and they're stabilized and they're walking out the door, but we're giving them the same kind of level of care that we would give for individuals with chronic disorders, health disorders. And that there are treatments out there that are effective. And we're part of that team of what creates effective treatment. And that because there is treatment that's effective, there is a disorder, I don't know how we cannot think of this as anything but a health condition.
For sure. And I'm looking forward to some of the other stigma conversations that we're going to be having with AMHC during our health fair, because I think you're right. As a community, it's our responsibility to help change those stigmas and change the language that we use that can be very convicting to the people who are already struggling with so many different unspoken needs. And, we have to definitely be far more sensitive than we are with our words and with our actions, and be as helpful and kind as we certainly can. All right. Well, thank you so much for your time. I appreciate it. And we'll look forward to talking with you again soon.
Thank you.